Hi, it's Dr. Medite, and I'm a clinical psychologist. Sometimes what looks like faith can actually be avoidance, and avoidance is extremely dangerous. We call this spiritual bypassing. Spiritual bypassing is when we use spiritual language or practices to avoid feeling emotional pain, like disappointment or grief or sadness. So it is jumping straight to something that sounds more positive or that sounds spiritual. And it can be confusing because it often sounds like truth, right? So we can say something like, oh, everything works out for our good. Or we can say, God has a plan, or it was meant to happen. Just forgive and give it to God. And these statements are not inherently false or they're not wrong. But when they're used or when they're said before someone actually has the time and the space to grieve, to feel sad, or to experience whatever emotions that's coming up for them, those statements can shut down that person's healing and make that person feel like their pain is not allowed or is not welcomed. And when emotions are bypassed, when they're avoided, they don't just disappear. They usually come back as they fester, and then they come back as anxiety, they come back as depression, as burnout, as resentment, and as physical ailment. um, and something I want to make sure that I communicate is that faith and mental health are not opposites. You can believe in forgiveness and still need time to heal, right? You can pray and still need boundaries with people. You can be spiritually mature and still be emotionally in tune and emotionally honest. You can trust God and still go to therapy. So spiritual strength is not bypassing or avoiding pain. It is being able to go through that pain, to experience whatever emotions that are coming up, and doing that with God and doing it with the support of your community and people that you trust. So bypassing is going around or attempting to go around, and healing is going through, right? With needed support. All right. I hope that helps. Take care. Bye bye.